the door opens up and I see all of these faces that look like mine. I thought, oh my goodness, what's going on in here? And those were his young adults with sickle cell disease. And everybody was just chatting about, and I thought, oh my goodness, this is like amazing. Basically what I have now at the foundation. It was the same, I really just reinvented that whole scenario. I am Dr. Lanetta Bronté-Hall, the president and CEO of the Foundation for Sickle Cell Disease Research. So I was a graduate student at the University of North Carolina at Chapel Hill. I trained at Duke, became a phlebotomist, started on the newborn screening floor pricking the heels. And so that's actually, sickle cell disease is a part of newborn screening. So little did I know at that time I was actually pricking the heels and sending off the test blots for to confirm, to see if that baby had sickle cell disease or sickle cell trait. Dr. Phillips looked at me and he said, okay, there's the patient, draw his blood. And I was like, what? So I can still see the patient, and this was an 18-year-old male with sickle cell disease. I can still see and feel Dr. Phillips. I can still feel myself standing right there. I mean, it's just so vivid. And so I looked at the patient, and then I drew his blood, and it was in a 30 cc tube, which is about this much. So that's, quite a bit of blood. So I now had this warm blood in my hand. I was holding it just like this. And so I looked at Dr. Phillips and I said, what do I do now? And he said, do what you've always done to the blood. Go to the lab, spin out the DNA and run the experiments. And I was like, oh my goodness. So I turned around and I run back down the hallway, holding this blood in my hand. Then I get to the lab, I start spinning out the DNA, but now I know exactly whose blood it is. I know, when I'm looking at the results, I know who's connected to. And I've just been with sickle cell ever since. I'm a clinical or an adult psychiatrist by training, but that's not what stuck with me. It was always public health. I have another degree in health policy and administration, and that was really the degree that opened me up to understanding health systems, how to develop healthcare programs, how to reach populations that are unserved. And when I look back, I think all of that was really preparing me for this journey that I'm on now with sickle cell. So it was never something that I chose. It was always just an easy path, and I just kept following. I wasn't resistant to the call. I just kept going, and then the disease and the people just tugged on my heart because they're so mistreated. They're thought of as drug seekers in the ER. Once they leave pediatric care, there are very few adult physicians who want to take care of them. So they're sort of outcast in society, and they almost become outcast by their family members because it's just really a struggle sometimes to understand the complexity of the disease and all the needs that the patients have. And then I thought, oh, what's happening with sickle cell disease? Just popped in my head like that. And so I went to decision support, which is like the IT department, and wanted to run some data on sickle cell. And lo and behold, we had like 1,000 unique patients. Most of them were going to the ED. You could see that they weren't getting a lot of care when they were in the hospital other than pain medication and hydration. And so I wanted to look for a better way to manage this patient population, and sought out another physician, Dr. Lanetta Benjamin, who had created a model to care for the patient's pain. She said they don't need to be admitted, they can be treated in an outpatient setting. So I worked with my hospital administrators, the board of trustees. We toured Dr. Benjamin's place in New York and Grady in Atlanta. And Memorial really allowed me to develop a sickle cell program there to meet the needs of the patients in the community here in Hollywood, Florida. And I became the director of a department that I created, and eventually came to the community, with that service. So it's just been a path that I have just followed. There are doctors who are hematologists, oncologists who go in to be sickle cell doctors, and my mission was more of a public health humanitarian. Even now it's really daunting when you know that more than 50% of the patients with sickle cell disease die before the age of 50. And that's, really hard to stomach every day, because I see the patients every day. Why are the sickle cell patients constantly going to the ED? We can break this cycle, we can break this pain cycle by getting them pain medicine faster, hydrated faster, and then creating a whole comprehensive program for the patients, which is what they need. He was telling me about the challenges that the patients experience in the ER, and I thought, wow. And I said, well, I guess we just need centers all over the U.S. I mean, I so clearly and just remember that. So for whatever reason, when I had that experience with him and dealing with the patients, I knew then that they needed their own system of care. So there were a lot of, little doubts, but they would just quickly go away, because at the end of the day, it was really about, I have to help the patients. I was like, I just can't watch them wither away. I can't watch the healthcare system treat them so poorly. I just had to make it better, and I still feel that way. It never feels like a job. It never feels like anything other than, it's almost like my child. Like, I'm going to take care of this child. It's just going to get done. You can't turn your back on it. I think instilled that giving into me, but that drive of like really caring for people, I got that from my grandmother. So my dad was in Vietnam, when I was first born. So we lived with my grandmother. So we were in Creedmoor, which is, a little country in North Carolina. It was a little farmland. And so I slept with my grandmother. So every morning, I think my grandmother got up probably about 5 or 6 o'clock. I still get up at the same time. So I'm an early riser. And we would go into town, and she would go into town helping whomever it was that she needed to help. She would leave home with $1 in her hand, and I don't know how she did all the stuff that she did, but I was going around with her doing these things. I don't remember all of it, but obviously it was, it's ingrained in me, because my mom always tells me I have the same personality as my grandma in terms of just going out and helping, and somehow not having any money, but making like all these things work and come together. And my grandmother was very religious as well. So I think just being with her all the time, and going around town in Creedmoor, everybody knew her. We walked the street, oh, hello, Trumella, hello, Hanny, and, waving to me. We go to the drugstore, and I sit up at the counter and order my food and say, put it on Trumella's tab. And so we just go all around the town, and she knew everybody, and everybody loved her. And so I'm sure that experience, as a toddler, it's not something that I vividly remember, but I remember that feeling. And I just remember that feeling of always helping. And I really, but I can see it, in the center. And even the way, like my medical director is Dr. Blyton, and I knew him at the hospital. And so when I opened the center to help the patients, I didn't have a hematologist, oncologist. I was like, I don't know what doctor's gonna come in here, but I have the building, it's set up. The patients are coming, I'll go hire a doctor. So I called up Dr. Blyton. I remembered him from the hospital. And I said, hello, Dr. Blyton. I said, this is Lanetta, sickle cell from Memorial. And I said, oh, I have a sickle cell center in the community. Wouldn't you like to come see it? And so he was like, okay. And he's the sweetest, most gentle physician. And he came by, and I said, wouldn't you like to see patients? And he was like, okay. And this was really like no contract discussion, no nothing. This was, the coming together of like-minded souls and hearts to help people, because Dr. Blyton has been in the community for 30 years. Most of the African American physicians in this community have been trained by Dr. Blyton, at some point in time. But he has, worked with sickle cell patients for over 30 years. So, he in the hospital, he was the one that they always called. I mean, he literally almost was rounding on all the sickle cell patients once they were admitted. And so he was the one. He was the one, that God just placed. I mean, it was just like effortless. I had literally, if I tell you that I put in a lot of effort into like getting loans, and I literally have done none of that. It has been like the easiest, effortless thing that I've ever done. I've never applied for a job since I left residency. It's just been like there. It's like when something is for you and you open yourself to it, it is for you. It works because you don't even have to do anything, just get up and keep breathing and just keep following that mission. We're doing great things in Florida, sickle cell. We have a government relations partner, Yolanda Cash-Jackson of Becker, who meets with us regularly to make sure that from a legislative perspective, we're able to address any issues, any policy issues that impact the care of these patients. We have a whole marketing team, content factory. We're just constantly being innovative in this space. We have to maintain innovation because the healthcare system is changing, and how are we working in that system to meet the demands of a very old disease that we have done very little about. So my goal is we have 7 centers now in the state of Florida, and we want to have centers outside of the state of Florida with a goal of having 70% of patients living with sickle cell disease in a center of care. We have 100,000 people in the U.S. living with sickle cell disease, so getting 70% of them in a system of care would really move the needle towards understanding a lot of the challenges that they have with the disease, the social needs that are unmet, and how these families live from birth throughout their entire life, not just how the disease impacts them, but their entire family. Their entire family is impacted by sickle cell disease. So there's a lot of suffering for these families. And we want to eliminate that suffering as much as possible. And it can be done because it has been done for other diseases where they live well. Hemophilia, cystic fibrosis, these are rare diseases children are born with. Sickle cell is a rare disease that children are born with. Out of the 32 plus rare diseases that we screen for in all babies, when we do that little heel prick, we're screening for many, many diseases. Out of all of them, the most common is sickle cell disease around the world. And it gets the least resources, the least respect. The people are mistreated all the time. It's so wrong. It's so wrong. I said I wasn't going to cry during this interview.